Hello, this is Janet Michael. In addition to hosting The Valley Today each weekday at noon on the River 95.3, I also produce podcasts. And I'm excited to kick off Season 2 of our podcast series in partnership with Rappahannock Electric Cooperative. It's called We Are REC. Every week we'll release a new episode talking to different people from REC about a host of different topics. We'll get tips for saving money on your electric bill. We'll talk about renewable energy and the impact it can have in our communities. We'll get some behind-the-scenes info about what happens when the power goes out in a storm. Don't miss out on information about community grants, scholarships, REC-hosted events, and more. Get every single episode on our website at theriver953.com under the podcast tab, or you can subscribe for free in Apple Podcasts, Google Podcasts, or on Spotify. Just do a quick search for We Are REC. Hello and welcome to The Valley Today. I am your host, Janet Michael. It is our Community Health Day, as it is on the third Thursday of every single month. We have had a couple of extra ones here in the last several months, obviously due to the COVID-19 pandemic, but I am very excited that today's conversation is going to be with Mark Nantz. He is the new president and CEO at Valley Health. Mark, welcome to the neighborhood and welcome to the radio show.
Thank you, Janet. Glad to be here.
So I understand that you have been here for quite some time, but I'm guessing that taking over a hospital in the middle of a pandemic probably wasn't at the top of things that you wanted to put on your resume. Am I right?
Well, it's not an ideal time to transition, obviously. But we got here the 1st of May. And so we've been acclimating since then. So we had about 30 days to get settled. And it's not very easy to move your home during COVID-19 either. We moved from about 450 miles away. And so that was quite the experience.
So tell me a little bit about yourself. Where were you moving from?
We had been in Greenville, South Carolina, the upstate of South Carolina, for the last 11 years. And so me, my wife, and the cat came up from Greenville in May, and the whole process, looking for a home, when you're looking for things online because you really can't go see people's houses. It was a totally different way of life.
And I think sometimes we don't really fully grasp all of the things that we take for granted until we're in the middle of a situation such as looking for a house to realize, wow, I did not realize how complicated this was going to be.
Oh yeah. And everything looks better online. So you have to, sometimes you want to feel it and touch it and see what it really is like and that kind of thing. But, we got through it, and the people up here were so accommodating and, let us vacated their homes and gave us gloves and masks and let us go see their homes. And so it all worked out. We got here. We're so glad to be here. And I'm digging this Virginia weather.
Well, that's because it's not December and January yet, but I don't want to blow any surprises for you.
Right.
So I know in my research, you have a pretty extensive resume in the healthcare industry. Tell me a little bit about your professional background.
Yeah, I've been in healthcare for about 30 years. Started out on the financial side of healthcare in Charlotte, North Carolina. Worked for a large system there by the name of Atrium Health. Kind of came up through the finance ranks and realized that I like working with people more than I like working with numbers. So I went back to school and got a master's in health administration and began to become more operational and working with the physicians and working with the people and the patients, and just found a real passion for that. It just felt good, and so ended up going to a place outside of Charlotte called Northeast Medical Center, and over a period of 5 or 6 years, and ended up becoming the CEO, and was there for a nice 10-year run. And then as things have it, you never know what opportunities come up. Somebody offered me a job to go to Greenville, South Carolina, to be a CEO of a faith-based health system down there called Bon Secours St. Francis. And so I spent 11 years down there. And then I decided to move along from there, and here comes Winchester. So, just you never know, but this seemed like a great place to be. A little bit bigger opportunity, and in a part of the country that we love. South Carolina. We hated to leave, but this is a beautiful part of the country, and are glad to be here.
So I got to know, when you were considering this particular opportunity, I'm sure that you Googled Winchester, you were doing a little bit of background investigation on the Shenandoah Valley. What were some of the things that really made you think, you know what, this could be our next new home?
Well, we love the mountains. We actually have a place in the North Carolina mountains that, ultimately might be our retirement home. And so we like outdoors, we like hiking, we like the leaves. So we loved the idea of being in a place where we would get a little snow. We'd have, nice opportunities to kayak and hike and do that kind of thing. But it's also very, very convenient to Dulles, if you want to go travel. So when the world gets right again, and you want to get on a plane, you're pretty much convenient to anywhere in the world. And you can pretty much move all around Virginia. You're close to DC, and there's just a lot of opportunity there to do things and see a part of the country that I've never seen. Now, my wife actually spent about 6 years in Roanoke, and she really loved her time in Virginia. And when we were deciding that we were going to look at a different job, and Virginia was on the cast of possibilities, she said, I really could go back to Virginia, no problem. So that had something to do with it as well.
So what has it been like? Because I know you took over June 1st. I had a conversation with Mark on the show. I think it aired his last official day as president and CEO. But this has got to be a strange way to come into, because you're not able. I remember Mark telling me that one of the things that he felt sad for you about was that when he came in as CEO, he was able to go around to all the different hospitals, and he could meet with people, and he could shake hands, and he could be interactive, and that in this current pandemic, you're not going to be as free to do a lot of that as he was. How are you going to handle kind of acclimating yourself?
Well, first of all, Mark has been so kind. I mean, Mark actually invited me into the room well before his last day. And he really was just he's such a professional. And he, about 30 days before, he started inviting me into meetings, into board meetings, helping me, get a little bit of a head start. Because I think he knew this is going to be difficult. Because you're right. I mean, it is very hard to meet people like this. It's not exactly what I'd hoped for. And what we've tried to do is, particularly with Chris's help, I do a video somewhere in the system like twice a week. So digitally, I am getting around. I am at the fitness center. I'm going to Warren. I'm going to Shenandoah. I've been over to Winchester Medical Center. So we're going to try to give everybody hey, virtually Mark's here. He's coming around. He's doing things. But I'm walking the halls. I mean, I'm staying socially distant. I'm keeping my mask on. I'm going to meetings. I'm hanging out in the surgeon's lounge. I'm hanging out in the cafeteria. And so I'm doing all those things. We're just doing them at a social distance and in keeping with the governor's guidelines. It is more difficult because, instead of having a town hall with 200 people in an auditorium, I'm having to do it, less than 50 at a time to make sure we keep with the governor's mandate and make sure that we keep everybody safe. But that's hard. I feel like I've told my life story about 50 times instead of maybe 5 or 6. But we're getting through it, and people will always remember. Oh, that's the guy who came in during COVID.
You're turning yourself into a version of the Where's Waldo of Valley Health, because they never know where you're going to pop up next on video.
Yeah, and that's we just at this day and age, thank goodness we have this kind of technology. Because if we didn't, it would be really, I can't even imagine how I would do it effectively. So I think it's going to take a little bit longer, Janet, and I'm going to have to probably work a little bit harder, but I think it's worth it. I think it's okay. And eventually we will find normal, and I will get to do those town halls, and I will get to walk around without a mask and shake hands. And I long for that day. I'll tell you that.
Well, and I think what you may ultimately end up finding is that the relationships that you're making right now with your staff and with the various doctors and the people within the system are probably going to be better for it, because it is a smaller group and people can have a little bit better of a one-on-one conversation with you than when they're sitting in that giant room with 199 other people.
Yeah, I think people are a lot less hesitant to ask a question or to ask me to elaborate on something. It's very easy to be transparent in a smaller group, and that way, and really come off as being genuine. And so the hardest thing for me is it's hard to. I like to laugh, and I consider that I have a pretty good sense of humor. It's hard to be funny on film. I mean, because if you think about it, even Jimmy Fallon's struggling to do it at home, not having the audience. But again, we're getting used to it. I think we're going to get there.
Well, and I guess the silver lining in all of this is too that at least you didn't have to step in and take over in late March, early April, when we were truly in the thick of this and still didn't know what this really was. So now at least it's a little bit loosened up a tad, which has to make it, I would imagine, just a little bit easier.
Oh, it does. I mean, I think it's serendipitous at the very least, and probably providential that the timing happened the way it did. Because Mark had 11 years at the helm. He knew the people. He'd done the disaster drills. He'd done the tabletop scenario planning. So he was best suited to start this and move it along. I would tell you that the staff here, the team, has really performed in just an exceptional manner. And the difference now is, back in March, we didn't really know what it was or how to react to it. I mean, we knew how to take care of people, but we didn't know the extent of it, what to expect. We've learned a lot in 90 days. So if we have a second spike, or, it comes back, we know what we're doing, and we know how to isolate the patients. We know how to keep going with our elective surgeries and our testing and keep those folks safe and keep the COVID folks where they need to be. We've learned a lot about how to do things remotely and with telehealth. So if we get a return spike, I think the public can rest assured we've learned a lot. I mean, there's nothing like experience as a teacher, and we have learned from our experiences. We've memorialized those things that we did well, and we've really said, all right, what are we going to do about the things we didn't do well, and come up with contingency plans. So I think, again, just to reassure the public, we got this. We will take care of business, and we will not be flat-footed. And I think I have to tell you, I thank Mark a lot for doing a lot of that groundwork to get us where we are.
Well, I'll tell you what, let's take a quick break. When we come back, can we talk a little bit about what you think the next 6 months, 6 years is going to look like under your tenure? Anything that, how you plan to move forward from old Mark to new Mark, even though that's probably not the most politically correct way of saying it. Can we talk about that in the second half?
Sure.
All right, we're going to do all of that when we come back. We are having a conversation today with Mark Nantz. He is the new president and CEO of Valley Health. We are pre-recording it and sharing a Zoom screen together. You, of course, are hearing it on the third Thursday of the month, which is our Community Health Day. It is one that we do every month in partnership with Valley Health. So we'll be back in just a couple of minutes and continue our conversation with Mark Nantz. Expecting to hear a commercial? That's what this is, sorta. First, I want to thank you for listening to the Valley Today podcast. You're one of thousands who listen to the show this way every month. Sometimes it's because our listeners are busy and they want to listen when it fits their schedule, or it's a guest of the show who want to hear what they sounded like when they were on the radio. We even have a few binge listeners who listen to a week's worth at a time. Can you even imagine? So if you want those people, your potential customers, to hear your message, then this could have been your ad. And the bonus, your commercial isn't restricted to just 30 or 60 seconds. You can take up to 2 minutes to talk to those customers. And there's even the opportunity to be an exclusive sponsor of the Valley Today podcast, which also gets you on-air mentions at the end of every show. If any of this sounds interesting to you, give me a call at the station, 540-635-4121, or send me an email to janet@theriver953.com. You can also find all my contact info by searching for me on theriver953.com. Welcome back to the Valley today. I am your host, Janet Michael. We are having a conversation on the Zoom screen today with Mark Nantz. He is the new president and CEO of Valley Health. Of course, we have pre-recorded today's conversation. You obviously are listening to this on Thursday afternoon. It is part of our community health partnership with Valley Health. And Mark, I have to say, before we restart our conversation, there was something that struck me as we were going to break a few minutes ago, and every single thing that you were talking about regarding Valley Health, you have already taken ownership. You said, we this and we that, and we've got this. And as a resident of Winchester, Frederick County, I got to tell you, it made me feel, whew, good. I'm so glad that this guy is here and he owns it. And I'm really looking forward to what you're going to do moving forward.
Well, thank you, Janet. Again, you brought it up first. You know, we moved into this community and bought. I mean, that's you got to buy in, and I don't want to be a renter in this situation. I want to have ownership, just like I want to take ownership in the ministry we have at Valley Health. And so yeah, I've bought in hook, line, and sinker, and I can assure you that my wife has too, into the community and to the organization that together we're serving.
Well, I've interviewed several CEOs, incoming, outgoing, over the last several years on the radio show. And I think the one thing that I have learned is never ask the new guy, so what do you plan to do better or change? Because more often than not, they're coming into a really good situation and it's not like they have to fix anything. So I know not to frame my question to you in this way, but you have a vision for where the next steps are for Valley Health.
I do. You know, I'm learning, and I want to make sure that I respect the past because you're absolutely right. What I'm coming into is an amazing organization. And, you know, sometimes I probably, if I could show the people that we serve what the health systems look like in a lot of communities of this size and how different what they have in terms of resource, quality of physicians, quality of facilities, quality of staff, this is extraordinary. This is not the rule, this is the exception. And that's one of the things that drew me to Valley Health and to Winchester. This is such an outstanding organization. It has, the Board of Trustees has put money back into it. We've invested in facilities, we've invested in programs and clinical services. And it's just, you know, there just aren't many jobs like this. So, you know, my vision would be to keep going in the direction we're going and to broaden our reach and our influence. I'd like to see us continue to grow in the surrounding communities, the surrounding areas with our other 5 hospitals. I'd like to see us continue to invest in the public health. I think as we go forward, we've learned a lot during COVID. The world changed. You know, for example, telehealth. Nobody really liked telehealth. The doctors didn't like it. The patients were like, I want to see my doctor. And the doctors were like, I need to lay hands on my patient. And then when you throw a highly contagious, deadly virus in there, you're like, well, maybe I don't need to see that person in person. And the patients have accepted the idea that it's still their physician and maybe they can do it digitally. And I would tell you, I think telehealth has moved forward 6 years in the last 6 to 8 weeks. And so I think that, you know, my vision is that we began to use technology and digital transformation to deliver care in the most convenient, most affordable place for the patient. And I think that we're probably going to pivot and do a lot more with technology and a lot more with telehealth. So things like that are in my vision of changing. And I think that's going to provide access to more people. If you think about the rural areas we serve, you think about the transportation issues, whether it be weather or whether it be economic, just think of how much access we can create with technology. And now the government has decided that it's okay to pay us for a telehealth visit. We don't just do it for free. And if the patients accept it, the technology will just keep getting better. And I think of how much we can change and drop the cost of care and increase the access. I'll stop there and let you ask me something else because I could keep going on this soapbox for a while.
Well, and it's interesting that you say that because a lot of the businesses too that I've talked to in the last several months, I've asked them, so what are some of the things that you had to put in place because you had to, that now you've realized, wow, this really can work and you're going to continue to do it. And I am all for telehealth. I think there are so many positives that it outweighs any, if there are any, of the negatives.
Yes. Yeah, I really do think it's just going to open us up and just expand what we'd accept as a good quality of care. Now that doesn't mean people are going to have to come to the hospital. They're going to have to come to their doctor's offices. But if it's a difference between no access and telehealth access, that is a huge thing we can do to change the community's wellness and health. And I would tell you that that's part of my vision as well is, health systems we've kind of made our business taking care of people when they're sick. And I believe that as time goes on, we are stewards of the health of the community's health. I believe that Valley is the steward of this region's healthcare. And it's incumbent upon us to create better outcomes by starting before people get sick. And that means wellness visits on, whether they be in person, whether they be on telehealth. That means us investing in community programs to educate folks, to create access. It may even mean working on affordable housing. How do we eliminate poverty? Because the social determinants of health are not just, do you have access to a doctor? It's, do you have access to high quality food? Do you have a roof over your head? So we're not going in those businesses necessarily, but we are aware that this community's health is our responsibility. And we're going to take ownership of that and work with other organizations and the public health department, try to figure out how do we make it better for everybody in the Shenandoah Valley, and how do we create opportunity and access?
I had Floyd Heater on last year. He's the president at Warren Memorial Hospital. And I joked with him because he thinks very much in the same way that you do. And I joked with him and said, you basically want to put yourself out of business, because if you could just keep people from getting sick so that they don't need to come in and have to see a doctor or have surgery, you would be perfectly happy. And he was all for that. He thought that was the way of healthcare for the future.
Well, I think we will have to transform ourselves. We're always going to have hospitals. We're always going to have the acutely ill patient. But if we can spend more money on the front end, we'll still have plenty to do. And it won't be a crisis. And again, you think about how much more high quality life that each individual can have. That's more time with your grandkids. It's more time with your spouse. And I think everybody wants to live a rich and full life. And the older you get, the more you realize that really is determined largely by your health and how you feel. And so I think there'll be no shortage of things for us to do. And there'll still be folks in the hospital, but again, we've got to think about what we look like in the future.
So before we wrap up, I do want to make sure that we touch at least for a few minutes on the COVID-19 pandemic, because I am knee deep in the middle of all of this. To say I'm a news junkie, my husband would laugh and say that doesn't begin to describe. It really concerns me that so many people tend to think right now that we're through it, and that is not at all the case. You guys are still very much encouraging people, wear your mask, do your social distancing. We're still in the middle of this pandemic, aren't we?
Yes, without a doubt. Things right now in Virginia are going well. We've seen downward trends. We've seen some of the lowest hospitalizations we've had. But that was happening in South Carolina, and that was happening in North Carolina to a certain extent. They're a little ahead of us in the reopening, and they've seen spikes. So we are trying to make sure that we encourage the public to remain diligent. I mean, I know it is not comfortable wearing a mask to the grocery store or wearing a mask to the Lowe's or the Home Depot, but that's what we need to do. For one thing, it's the governor's order, and we're being allowed to get out and be about and exercise our freedoms. But I think there's a lot of responsibility that comes with that, and if you don't wear a mask for yourself, then wear it for everybody else. And so we've been doing that. We've been masking at Valley for 30 days or more. just because we know it's the right thing to do for the patient and we know it reduces the spread of the disease. I just want to make sure we keep people ever diligent. There probably will be more cases. We probably will see a spike. We will probably live with this for quite some time. But as I told you in the first segment, I think we know what we're doing now. I think we got it. We can live with it. But what we don't want to do is throw caution to the wind and go back to everything we were doing and overwhelm the health system because the cases get so high. That's the only risk. And we never got close to that in the first wave. As long as we can manage that, then we can take care of everybody, both the elective and the emergent and the COVID. So I just would encourage people, keep wearing your mask, keep washing your hands, be with people, but don't be in too big a crowd. So, do the right, smart thing so we can keep, beating this disease.
Stay home if you're sick. That's always the big one.
Absolutely, stay home
Which
if you're sick.
is funny to me that's the hardest message to get people to do, because when I'm sick, I don't want to go anywhere anyway. So it always boggled my mind that stay home when you're sick was a hard message to get people to understand and agree to.
It is kind of funny, but that is the truth.
Now, are the testing sites that Valley Health has, are they still open currently?
Yes, they are. Yes, they are. And our testing capabilities are getting better. We've added technology so that our results are quicker. And that's really what's allowed us to open back up elective procedures, because we test you about 48 hours in advance, make sure you're negative so it's safe to bring you in. We really couldn't have done that, 6-8 weeks ago, because the testing was running, 72, 96 hours out. And so that's, by then you could be reinfected again. So we're getting better, still not where anybody wants to be. The other thing that we're watching constantly is our personal protective equipment, because that's if we use it all up doing elective surgery and there's no stockpile, if we have kind of a reboot, we're trying to manage all of those different variables to make sure that we have an adequate stockpile if we get hit again. We continue to buy up everything we can get, and we're getting to a place where we're feeling a lot more comfortable. And I think as time goes on and if things stay down, we can get ahead of it.
Well, we've got to wrap up today's show, but Mark, I want to thank you very much for taking the time out of your day to have this conversation with me. And I'm going to put you on the spot and say, will you come back and do another show?
Oh, absolutely. And maybe by then I'll know what I'm talking about. I've actually been here for 6 months or something, but I'd love to talk to you again, Janet. And again, we just appreciate the support that Valley Health System gets from these communities and your listener area. And we are just humbled and thankful that we have the support of the community.
Absolutely. Well, we are glad to be community health partners with Valley Health as well. You guys really do help us get the message out in a lot of cases. So we appreciate that on the radio station's end as well. We are going to wrap up today's show. We have been having a conversation with Mark Nantz. He is the new president and CEO at Valley Health. I will put all of the show notes and contact information for Valley Health, the testing sites, everything that we have talked about today on the show notes page. Again, you can access that on our website at theriver953.com. Just click the Valley Today banner on the front page or choose the podcast tab. We have a special tab just for Valley Health, as a matter of fact, under podcast. If you choose Valley Health, all of the shows that I've done for all of these community health partnerships can also be found there in podcast form as well. Tomorrow, of course, as you are listening to the show, is Extension Office Friday. So Molly Beardsley's going to come over from the Frederick County Extension Office and have a conversation with me. Meet me back here tomorrow, a few minutes after noon, and I will have that conversation ready to go for you.